experience of a caregiver to the rural regions, and then experiences within the LGBT community, and important information. And now we'll open it up for questions.
My question is for Mr. Green.
Yes.
And thank you all for your wonderful comments. But Mr. Green, I really want to thank you for telling us your personal story. I think makes something that's a powerful thing to do. And we have a lot of literature about men who are caregiving, and it's mixed, and we don't know a lot about it, except that some men find it more difficult than women to take on that role, that they may not have the skills or the knowledge or whatever. And I'm wondering if there was one or two things that were really helpful to you when you began to be a caregiver, so that you could say to yourself, I'm a caregiver now and I feel comfortable doing that.
Okay, I think that's a good question. Pansy and I, like I said, we've been married going on 59 years. For 35 years, Pansy and I were involved with Worldwide Marriage Encounter. We gave talks for 35 years to couples to increase and get a better relationship. So it's from that point on that one might say that we were pretty close. I don't know if we were any closer than anybody else, but we have been a very close family and close, so it didn't come difficult for me, not at all. And I think, well, no one's in this group, but anyone that has experienced the Worldwide Marriage Encounter weekend could attest to the fact that it is for couples. And that's where it started for us 35 years ago. And we stopped doing the weekend about 2 years ago. And it's not easy. I don't think I portrayed it as being easy, but it's something that I know I need to do, and I just do it. And you know, you may look at a gentleman here or a gentleman there or somebody else to say, oh, hell, what the hell? How are you doing it? But I do it. I mean, we're in this together. We're in this journey together. And as long as we're able, or I'm able, to be there as caregiver with the help of my family or whatever, I'm there. I don't know what tomorrow's going to bring, but at the same time, I can't look ahead. I just got to look at today. I know where we were before, but I try to make it positive for today and try to make it positive for her.
I really wanted to thank the different presenters for the really informative presentations that I think will really help the committee. My question is for Dr. Friedrichsen-Goldson, and it actually has to do with, I think, an issue that you brought up that's quite important, which is about workforce and training. And you mentioned the importance of training the workforce to be more responsive to the needs, preferences, values of LGBT caregivers. I'm wondering if you know of any training programs or approaches that have been shown to be effective in actually improving the quality of care.
Thank you for the question. It's a very important issue. We have, a part of another project, developed specific competencies for people across a variety of settings to be able to better support LGBT older adults and their caregivers. There's also, through the National Resource Center, there's a competency-based training to be able to work with caregivers. There's also one, and older adults, and there's also one out of Boston where they have developed resources to be able to, and training specifically to be able to work with providers and direct care workers. And I know that Cliff and some of the others have also been field testing and implementing caregiving support services that are directly and training directly based to be able to support LGBT older adults and caregivers and their families. So there's a lot of initiatives currently underway. There's fewer that have actually been systematically evaluated And so that really is a next stage that's needed. While there are numbers of different support services, many that have developed out of community-based organizations themselves, I think there's more work now to really be able to systematically evaluate some of those and really be able to test and develop best practices in these communities.
Thank you all. I add my thanks. Cliff, my question is for you. One of the things that you mentioned, or you did not mention, that was on your slides was an elder neglect and abuse app for law enforcement. Can we talk about that a little bit?
Yeah, I saw that flashing light saying you're out of time, so I skipped it. That app we developed because there's a this is a situation that happens all over the country. It's 3 in the morning. A law enforcement officer stops someone. You think maybe there's something going on. Is there some cognitive loss? You ask a couple of questions. And unfortunately in Georgia, we've had 2 situations where the person gave an answer and the cop let them go. And that person wandered down the road another 20 miles, saw a farmhouse, probably it looked like one he had grown up in, and tried to get into the farmhouse in the middle of the night and was shot and killed. Now, so what we've done is, with hearing these stories time after time again, because it's easy in Atlanta to get on a road from a rural town and just drive, and you can drive 20 and 30 miles. So they may know you in town, but they don't know you in 2 or 3 counties over. So we started working with the Alzheimer's Association and also our Alzheimer's State Plan, and a perfect storm came together. We've developed an app, and the app primarily is for law enforcement and adult protective services staff initially, but there are also features on that app for the general public. And both apps, by the way, are on Google Play, available in the store, Google Store. That law enforcement officer now has 3 things. Number 1, he will look and see if there has been a Maddie's call. And that Maddie's call is an alert that someone with dementia has wandered off. The Maddie's call was done that night where the officer did check that, but now he can check that Maddie's call on this app. Number 2, we have some screening questions. We got with Emory University and some folks over there. Some of you know Jenny Helms from the Alzheimer's Association, and Dr. Larry Toon developed. And so I think there's 3 cognitive questions, and 2 wrong answers trigger a screen, or a referral rather. And the referral is that it's saying to the policeman in the middle of the night, you need to put this person somewhere. The problem has always been you either had to put them in jail or the hospital. Okay. So through the Alzheimer's State Plan, again, we have gotten money this past last session for there is emergency placement. We've just put a contract in place about a month ago. And so now a police officer at 3 in the morning can put in the address, he calls the phone number and says, here's where I am, and then the dispatcher finds the nearest assisted living or nursing home that can take that person, and it might not even be by zip code. It may be closer than the zip code that he's in that you can do that. So we're really excited about the app. Many different things on the app other than emergency placement. Laws, all the laws for abuse, neglect, and exploitation. And you say, well, how does this help caregivers? Most of these calls we get in the middle of the night are from people in rural areas that wander off. It's a terrible problem. You can imagine having to call the caregiver and say, your relative got shot, your relative got killed, Or in one case, we had a situation where the person wandered off and they got stuck on the barbed wire. Their jacket got stuck and they froze to death. So this is an indirect way of helping caregivers, but again, we've got to educate our workforce and give them the tools to be able to assist these families. Because a lot of families, as Lisa can tell us, are in denial. And the precipitating incident is someone who wanders. It's nice to have a better outcome, and these are some tools to do it with.
Thank you to all of our speakers. Cliff, I have a question for you. You mentioned a web portal for the seniors in rural communities, and I was just wondering about how they access the portal, given that broadband and internet sometimes is lower in rural locations, especially for seniors.
We do know that the portal will actually be available to all people in Georgia, not just rural areas. I don't have a magic answer for the issue you're describing. We do find out that increasingly we have caregivers, long distance or otherwise, who increasingly find us on the web and call with questions. We also know with increasing aging population and scarcer resources, our gateway and intake staff are just getting more and more inundated. We think this is a strategy for those people who are savvy and who do have the access, that they will indeed do some of the looking before they get tied up with gateway. Another phase of that portal would be to put all the funding options on there. So not just the services, but whether it's private pay, whether it's cost share, whatever the fund sources are, and that will be our next phase. But I wish I had an answer for the rural area, but I don't. But we do know, we get emails all the time from little areas. I don't know how they get their access. Good question.
Also for Mr. Burt, your presentation of all the innovations in rural care are impressive. Could you say a little more about some of the unique challenges of rural caregivers compared with the urban caregivers you serve?
One of the things, I think I listed some in two of the last three slides. We really need to do more, we feel, with self-directed care. This is an area where we get a lot of frustration from rural caregivers. And I did mention this in my remarks. You have one agency that provides the service. And the rural caregiver says to us, I can't call 2 or 3 other agencies. I called this woman, this agency. They sent me somebody. But the problem today is, well, they sent me a person, but then I needed to leave, and I needed to go to Atlanta for 3 or 4 hours to do a doctor's visit and whatever. The problem is they send me someone different every time. So I spend the first hour orienting them, or an hour and a half, and that cuts into my valuable time to get other things done. And so they really don't want to use any more formal services. They don't want to try the same agency again, and they really, now again, self-directed care is not for everyone, but there are caregivers who would like to do the self-directed care. We did a training program in a very rural AAA called Northwest Georgia AAA, where we had someone to do the fiduciary responsibilities so the caregiver wouldn't have to do all those. We tried a big company that didn't work out so well, so we tried hiring local people. But we hear this over and over again. Either I've tried that agency and they send me someone different every time, or I want to try it myself.
Thank you. Please join me in thanking our panel for... And we now welcome Dr. Ladson Hinton, who's going to give us some closing remarks of our session this morning. Thank you.